Hello and welcome to the Medical Sales Podcast, and I am your host, Samuel. In this podcast, I interview top medical sales reps and leading medical sales executives across the entire country. And it doesn't matter what medical sales industry, from medical device to pharmaceutical to genetic testing to diagnostic lab, you name it. You will learn how to either break into the industry, be a top 5% performer within your role in sales, or climb the corporate ladder. Welcome to the Medical Sales Podcast. Hello and welcome to the Medical Sales Podcast. I'm your host, Samuel, and today we have with us another special guest, and she goes by the name of Lejla. Lejla works for Olympus as Director of Marketing for Lung Cancer at Olympus. And this is a very timely episode because in the spirit of World Lung Cancer Day, I couldn't have a better guest than Lejla to explain her role and what it really means to be someone that wants to work in the clinical support manager role at an organization in medical sales. But I'm not going to spoil the episode. You're going to have to tune in. So as always, we do our best to bring you guests that are doing innovative things in the medical sales space, and I really do hope you enjoy this interview. Hey, Lejla, how are you today?
Hi, Samuel. Doing well. What about you?
Fantastic. No complaints. So why don't you tell the audience who you are and what you do?
Of course. My name is Lejla Sarajlic, and I am the Director of Respiratory Marketing. Specifically, I focus on the lung cancer sector of our business. So my portfolio covers technologies that are used to both diagnose and treat lung cancer. And I don't know how much the audience here knows about lung cancer, but essentially it starts as, a small nodule out in the periphery of the lung. And as it grows and spreads, it gets into the lymph node of the patient's body. In order to be able to effectively provide treatment to that patient, you have to get tissue from both the lymph node and the lung. So the business that I'm in, we sell both the capital equipment and the disposable devices to drive out to that area of the lung and effectively sample that tissue so that we can provide treatment and hopefully help stage shift and save that patient's life.
Wow. So Director of Marketing, give us a little bit about how your role, the majority of our audience are sales reps or people that want to be sales reps, and you've been or I would even say clinical, specialists, which you've been. Give us a little bit about how director of marketing, what's your role in connection with the sales team?
That's a great question. So yes, I started out back about 10 years ago within a clinical support role, specifically focused on research. So I was traveling probably 80% of the time all over the country.
Wow.
And I was starting new programs at hospitals. I was installing the equipment that we had at the time. It was thoracic navigation. So I installed the equipment, I trained all of the staff, I did initial procedures, and it was all for research purposes. I was at those big academic institutions running those clinical trials. So from there, I decided to go ahead and move into training. So I had such a big passion for training, not only the external customers that we had, our physicians and staff, but also internally, our sales reps. So as part of training, I got a chance to touch each and every sales rep within the organization. And I developed a curriculum to help make sure that they were able to succeed throughout their training, their new hire training. So fast forward to now, I'm in marketing, and honestly, marketing and sales work hand in hand every single day. So without sales, there would be no marketing. As part of marketing, I help set strategies that drive what sales does day in and day out. So we have a revenue number that is our target for the year for the sales reps to meet. And it's marketing's responsibility to develop those strategies that help drive those sales reps to make sure that not only they hit their number, but they surpass it through organic growth as well. So again, every single day I touch base with sales reps, the regional vice presidents, just to ensure that we remain, in communication and collaborate towards the same goal.
Got it. Okay. So that's, you have a very expansive role. So let's dial it back to when you started, because again, a lot of our audience, it's good for them to see everything, right? Because they have ambitions, and to see someone start off as a clinical specialist and climb the ladder to be director of marketing, everybody needs to know that's possible. But let's go back to clinical specialist and let's talk about what's the difference between clinical support manager a sales rep, an associate sales rep? Like, shed some light on what those differences are for our audience.
Of course. So, as a clinical support specialist, what we did is at the company I was at, it was a startup medical device company. We had a team that was based out of St. Louis, and that team helped, like I said, cover installations, evaluations. If there was a new product that was launching, we would help support that as well. We worked hand in hand with the sales reps in the field. So, we have, capital reps, we have disposable reps that are regionally located within the country. So we would communicate with those reps, and when they needed a clinical expert there, we would attend and help them run that initial procedure, the evaluation, the installation. Essentially, the clinical support team is a great place to start because you become the clinical expert of the product. You're not so focused on selling strategies. Yes, you're part of the team that sells because without you, they can't do what they do in their day to day, but you are more so focused on the product itself. Make sure that it functions appropriately, make sure that you support the staff during the procedure, and you're essentially customer support is the best way that I would phrase it. But it's a great place to start. You learn about the industry, you learn about the product, and you get a chance to see a little bit of what sales is about, and from there make a decision of is that the right place for you to take your next step.
So talk to us a little bit about, you know, as a clinical specialist, what's your day-to-day look like? How is it different from what a sales rep does?
hmm As a clinical specialist, every day was a little bit different because you had to be flexible. So when I took that role on, mind you, I was fresh out of my master's program, single, and I was ready to travel. So I was on the road about 80% of the time. I was living out of a suitcase, left for the week on either Sunday or first thing Monday, came back either Friday night or Saturday morning, did my laundry, repacked, and did it all over again. And I would remember specifically getting calls from my manager while I was in the airport saying, actually, this case just canceled. I need you to go somewhere else. And again, this was a clinical support specialist for the entire country. So you didn't have a region. So you had to be ready to, make adjustments as need be. Me being a planner and a control freak, that was initially very difficult to get used to, and so I didn't know if that would be the right fit. But as soon as I gave it a try, I loved it. I got a chance, to meet people from all over, build my network. I have still amazing mentors from all over the country through that role specifically. And it allowed me from there to figure out what the right next move would be for me. So I think for somebody that's looking to get into sales, like I said, that would be a great place to start because, again, your day to day can vary depending upon what industry you're in, essentially. So that's one part of the role. The other part of the role is we would actually rotate and take customer support calls in the office as well. So every other, probably about a week or so a month, we would do that. And the other 3 weeks, we would be on the road rotating and covering those cases.
So, okay, so let's talk about customer X, and you are the client's the clinical manager for customer X. So you're there for utilization, you're there driving the use of the product, and you still have your sales rep. Problems happen. I'm assuming the customers go to you first before they go to the sales rep. Do they go to both of you? How does that work?
So we had actually two different applications, and we still currently have the same, route of communication at the company I'm at currently. Essentially, we have a phone number for the customer to call that gives or leads them directly to the customer support team, which would be the clinical support specialist. So there's that avenue. And then we would give accounts little iPads that they could use to call for virtual support. And again, it would go straight to that clinical support team that was based out of the home office. So customers would naturally go towards that avenue prior to calling the sales rep.
Got it. So I mean, gosh, and with that type of I don't know, protection, for lack of a better word, I mean, that's kind of what you guys were then. You guys were kind of like the protector for the sales team because they can focus on getting the business, and you guys are managing all customer issues whatsoever.
Correct. And the best part about it is, the home office team, we communicated on a regular basis. So we knew all the issues that would come in. So we would be able to quickly, resolve whatever the customer was asking about, as opposed to if they called the sales rep, they would probably go through multiple avenues to get the answer.
That is awesome. So When you think about the kind of person that would make, well, actually, let's talk about this first. What makes an amazing clinical clinical specialist? What makes an amazing clinical specialist from your perspective? And feel free to give it to us from even your expanded perspective, because you're pretty far removed from that now. But give us the top three things that make an amazing clinical specialist.
So, first of all, you have to be flexible. I know I mentioned that from the get go, but your day to day will change and you have to be okay with that. So, that's definitely one thing. You have to be a good communicator. So, a big part about a clinical specialist role is education and training. And if you're not able to explain the product effectively to a customer from beginning to end, then the role may not be for you. Um, it's really about taking a difficult concept, breaking it down in your own language, and then being able to disseminate that information to your audience. So I think that's definitely key as well. The third one, it would be probably be comfortable being uncomfortable. I know that's not necessarily, a trait or a talent or whatnot. It's something that you learn as you grow. And I will tell you that's something that I learned within my marketing position that I'm currently in. I've been, I've been in training for about 6 years or so. And I got really comfortable doing what I was doing. I was very good at it. Same thing with the clinical specialist role. I was very good at what I did. And at that point, it became difficult for me to try something new, to venture out of that comfort zone. So I would say, be comfortable being uncomfortable, because that's a lot of what the role is going to be.
Awesome. Awesome. Okay. So you went from clinical specialist and you went to training. What drove you into training? What was the impetus there?
So training still, I smile because it's my passion. It really is. I love education. I love taking something, like I said earlier, difficult to understand, breaking it down, teaching it to somebody else, and then watching them apply it. And that's what sales training was. I taught them something and then I saw them apply it in a real situation and then hit their revenue number for the year, their quota. And that was so wonderful for me to see. So I would say that's really what drove me within the space. Is that's where I noticed that I get the most pleasure and joy out of what I do on a day to day. And honestly, sales training allowed me the opportunity to have a hand in every sector of the business. If you think about sales training, you're building out sales process, you're involved in product launches, you're in procedures, you work on KOL development, you go to conferences and courses. You literally have a hand in everything. And from there, it's a really great opportunity for you to decide what the next step is. So I'll tell you, there's a lot of sales reps actually that are in the sales rep role for a few years, and then they decide they want to go into sales training because they don't know what the right next step for them is. And I think that being within that position for a couple of years really gives you that clarity in terms of what do I want to do next with my career path.
That is fantastic insight. Can green professionals, green to medical sales, can they go into sales training?
Um, Sales training requires, honestly, that you have a little bit of background in sales, because if you think about it, you're going to be training the sales force, and sales reps need somebody that has credibility to teach them what they're going to be doing on a day to day, right? So I think a sales training position definitely will require a little bit more of experience. That being said, there are training coordinator positions that are a step down that essentially help the sales training manager with their day to day. That I think is a good way for green reps to get involved in something like that if they wanted to try a different avenue.
Fantastic. Okay. All right. So tell us a little bit more about the opportunity for people that are thinking, they're listening to this episode right now, and they're
Mhm.
thinking to themselves, I'm not quite there as a sales rep. I want to be in medical sales. I want to be in the business of medicine. This role that I'm listening to that Lejla started in sounds very attractive. Give us just a little bit more that they can kind of weed through to see if it's something that they should pursue or not.
Yeah, so I actually started out prior to the clinical specialist role. My background was pre med biology. So I'll take you way back then to give you a little bit of just an idea of what, the other paths that you could take within that process. So I was pre-med biology, like majority of, the med device sales reps were initially starting out. And it wasn't until about my junior year that I had a mentor of mine that approached me and said, okay, you want to be a doctor. Are you sure that that's the right next step for you? And I was like, of course, I want to help patients at the end of the day. And that seems like the natural next fit for me. Well, that, mentor of mine, thankfully reminded me that, medicine isn't what it used to be. So the pay isn't the same as it used to be. So if you're doing it for the pay, that's the wrong reason to do it. Malpractice, that's a big thing to worry about. If you're wanting to help the patient, forget about it because you're going to be charting majority of the time. You won't even have time to spend with that patient. So it forced me to take a step back, and actually I ended up changing my major. I still finished the pre-med route, but I ended up switching my major to nuclear medicine technology, which
Wow.
a lot of people are not familiar with.
Why nuclear? I mean, what inspired that?
Yeah. So while I was going to St. Louis University, where I attended college, I did an undergraduate research position all 4 years in nuclear medicine, out of all places. So I got a chance to work with data, analytics, write manuscripts, abstracts, things like that with the residents and the physicians. And I got a chance to learn a little bit more about imaging and just the medical space in general. So my mentor at the time was actually the professional director of the nuclear medicine program, and
Wow.
so yeah, he got me into the program. So honestly, though, I think that's a great place to start. So I think having a background in healthcare really opened up the avenue for me to see what else is out there. So I was specifically in imaging, like I said. Imaging, there are a lot of reps in imaging when you look at the different, CT machines, MRI, nuclear medicine, gamma cameras. There are a lot of different reps, Siemens, Philips, whatnot. So I got a chance to explore the industry side a little bit, just to know that that's for me. So I would say if there's a sales rep out, or if there's a an individual out there that doesn't know if medical device is for them, um, doing some sort of like a imaging type of a role, or a role within a hospital, just to get acclimated to that space in the industry, I think would be a great first place to start as well. I know a lot of times people are very quick to say, well, try to find a sales role. Yes, sales is part of it. But I think the healthcare setting is an even bigger part, because at the end of the day, it all goes back to the patient. You're going to be in those procedures. And if you can't stand the sight of blood, you can't, stand in the OR for 4, 5, 6 hours, and it just might not be the space for you.
Well, and not only that, but being a clinical support manager, you don't have to have that sales background. That almost serves as a prerequisite, or
Correct.
it can be regarded as a because we don't believe in that here at Evolve Success. We know that people can get positions without having that as a
Oh,
prerequisite, but a lot of the industry just kind of has that belief. But as a clinical support manager, you don't have to have that, right? You can just
correct.
show up, well, like you said, have some healthcare background, and you're very much eligible to get that position.
Correct. Yes. You really are. It's honestly at the end of the day, it's all about how you sell yourself, right? If you feel like you can do the job that's in front of you, and you can make the person across the table from you believe that you can do the job, you will get the job. I
Could
mean, you
not have said it better.
just
Those are the facts. And it's funny you say that. What is your take on, what kind of thing that we do here at Evolve Success? What's your take on that? To have an opportunity to work with a team of professionals that are all focused on helping you get the position.
I think that is so important. I think building, so when I got into medical device, I by chance just landed within the industry. So that doesn't happen nowadays. I didn't even know medical device truly was an industry. So I applied through Indeed for a image guided surgery position. I remember still it saying that on the application. I get a call from a recruiter the next day, and again, at the age of 22 years old, you don't even know what a recruiter is. You think it's like a caller thing. And fast forward a couple weeks later, I get the job. So I'm very fortunate that it was the first job I applied to, the only set of interviews I went to, and I landed my dream job, ideally, that got me to the place that I am at now. And I did that without knowing anyone within the space. So I say that because nowadays it's very difficult to land a job like that without building your network around you. If I can be of assistance to anybody in terms of, taking that next step into the medical device world, I would love to do that because I didn't have that for me. And I see how important that is in a day to day, in terms of, not only getting the role, but also accelerating throughout, your career path and getting that next step within the job.
Absolutely. Well, give us the other side of Lejla. So there's the professional side, that's the director of marketing, and had an amazing career. And then there's the personal side, family, kids. Give us a little bit. How do you make it all work?
Yeah, so I think work-life balance is extremely important. So before I actually get into that, I'm going to share a little bit of a personal story
Absolutely.
that might just share, give you a little bit of an insight on who I am. So actually, I'm from Bosnia. My parents actually immigrated here to the US in the 90s. There was a war going on at the time in Bosnia. And so they thought the next natural step would be to come here to the US to give me and my brothers an opportunity at a better future. So essentially everything, that I've done up until this point is just to show them that their sacrifices were worthwhile. That being said, in my personal time, because again, I am not from here, I absolutely love to travel. So I gave myself, a bucket list of places to go
Oh,
every
come
year.
on.
And I've been to about four or so continents and 20 plus countries within the last 5, 6 years or so when I first really started to make some money so I can travel. And that's a true passion of mine. So I think honestly, work life balance is so important because you have to take a pause and do the things that you love to do, right? So if I love to travel, I'm going to take a week or two off a year and go travel. And that's what I've committed myself to doing and I plan on doing
Oh,
moving
that's
forward.
beautiful. This is solo travel.
No, it's been with friends. I have a trip coming up here going to Hawaii actually. I've not been to Hawaii yet.
Oh,
Uh,
wow.
yeah, so no, it's been a combination. It's been friends, it's been with family. So, yeah,
That is fantastic. And you said you had brothers,
I do. I've got two brothers.
2 brothers.
Mhm.
Fantastic.
They
Okay.
did not take the medical route. They're both engineers, so
They're both, they're both engineers. So,
yeah.
okay. So if they wanted to, they'd make fantastic medical sales reps.
Oh, I think so too. I think engineers make great med device reps.
Absolutely. Absolutely. Okay. Well, that is fantastic. Well, Lejla, it was such a pleasure having you with us today. Is there anything more, like a personal philosophy or just something you want the audience to just leave with after listening to this episode today?
Yes. So I would say if I have to give advice for somebody wanting to either enter the space or grow within the space, there's probably three things I'd leave them with. So, one, always make sure to have goals in front of you and attainable goals with a timeline and make sure to refer to them on a regular basis. That's the only way that you're going to keep climbing within this industry. And once you land your job within medical device, make sure to start building your brand and start building it early. So make sure people know who you are, ask questions, have your camera on during calls. That's the only way that someone is going to know who you are. And when an opportunity presents itself for a promotion or whatnot, you're going to be the first person, that comes to mind. So definitely build your brand and build it early. And lastly, networking. I'd mentioned this already. I think it's very important that you have mentors within the space that help guide you and that you surround yourself with people that, want to see you succeed. So when it comes to a mentorship perspective, I always recommend to have three mentors: somebody that is a superior, somebody that's equal to you, and then somebody that's in a totally different industry for perspective purposes. So I would say those are the three things that I would recommend somebody, put into action as quickly as possible.
And that right there is sage advice. Love it. Okay, we're going to do one more thing. This is called the lightning round. I'm going to ask you 4 questions, and you have less than 10 seconds to answer them. Are you ready, Lejla?
I am ready.
Okay. All right. Question number 1. What is the best book you've read in the last 6 months?
Ooh. Talking about goal setting, actually, it would have to be 12-week year. I don't know if you've heard.
Ooh, yeah, I've read that. I've read
Yeah,
that.
it's
Yes.
a good one. Yeah, it
It is.
redefines goal setting. You're looking at it from like a 12-week perspective as
Mhm,
opposed to a year perspective. It's a good one.
mhm. Very inspiring book. I like that one. Okay, best movie or TV show you've seen in the last 6 months.
Only because I've been watching it on a very regular basis. Suits has been definitely a TV show that's been on the TV very regularly.
I've never seen it.
No.
I've heard so many things about it. In one sentence, why should I watch it?
Oof. So there's a lot that goes on within Suits. I would say every you leave each episode wanting to know more.
Okay.
So it's
Okay.
a great cliffhanger.
Great clip. I'll take it. All right. And then best meal you've had in the last 6 months. This can be a restaurant. Go ahead.
Best meal. So aside from my mom's cooking, I will say St. Louis has really good ethnic food. There's a Turkish place called Aya Sophia that has these like lamb meatballs that are
Ooh,
really, really good. So
ooh,
highly
Aya
recommend St. Louis.
Sophia.
Yes,
Okay. And this is where is this again?
St. Louis,
This is
Missouri.
in Louis, Missouri. Okay. And then lastly, best experience you've had in the last 6 months.
Well, that's an easy one. So my brother just got married actually back in May. They had a destination wedding over in Mexico. So that was just an awesome experience with the entire family getting to see him marry the love of his life.
Oh,
So
that's beautiful. That's
yeah.
beautiful. Lejla, it was fantastic having you on the show today. We can't wait to see the wonderful things you do out there in the medical device sales world.
Awesome. Thank you so much, Samuel. Happy to be here.
Absolutely. And that was Lejla. What a fantastic story. You know, what I love about Lejla's story is she really did kind of ride the blessing, right? She was introduced very early and she just rode it all the way to the top. And even though she got there so quickly and she took on so much responsibility so quickly, her first motivation is to give back and help others. And that goes a long way. I mean, that really speaks to the type of character that Lejla is. And I was so happy to have her on the show. So I bet you're listening to this and you're wondering to yourself, how do I get myself into a position like Lejla? Maybe, I don't have a sales background and I don't necessarily want a sales role, but I want to be in medical sales. What does it look like for me? Maybe it's a clinical specialist. Maybe, like Lejla, it's a clinical support manager. And if that's where the direction of what you want leads you, then guess where you go next? That's right. If you listen to my episodes, then you know exactly what I'm going to say. And I'm going to say you need to visit evolveyoursuccess.com and let us help you get to where you want to go. Visit the website, fill out the application, speak to one of our executives, and let us get you into a role with a program that can do just that. As always, we do our best to bring you innovative guests that are doing things differently in the medical sales space. And I hope you tune in next week for another episode of the Medical Sales Podcast. I hope you enjoyed today's episode. And remember, I have a couple programs that show you exactly how to break into the medical sales industry, become a top-performing medical sales professional, and also how to masterfully navigate your career to executive level leadership. Check out these programs and learn more at evolveyoursuccess.com. Stay tuned for more awesome content with amazing interviews.